Hello and welcome, Gold participants and listeners from around the world. I'm Kristin Schwarz, licensed midwife and MC for Gold Learning. And I'm here today with Dr. Andrew Kotaska to chat a little bit about his upcoming presentation titled Two-Step Delivery and the Prevention of Shoulder Dystocia. Welcome, Dr. Andrew Kotaska.
Good morning, Kristin. Nice to meet you again.
Good morning. I'm so thrilled to have you back here with us today. And of course, we will chat about the presentation that you are about to give here for us at Gold. But before we jump into that, can you tell our listeners a little bit about yourself, your background, your professional journey, and anything you feel is important to know about Dr. Andrew Kotaska?
Well, I initially trained as a family physician and went out and worked in rural British Columbia and quickly realized that I wanted some surgical skills because I was passionate about obstetrics. So went back and became a GP surgeon and then provided cesarean section and backup obstetrical services in northern rural remote settings that didn't have an obstetrician. And after doing that for half a dozen years, I realized that my passion wanted to take me further, and so I went back and did a residency in obstetrics and gynecology, and have been involved in that since, working as a generalist obstetrician in Yellowknife up in the north, which is about as far north in Canada as you can work as a specialist obstetrician, supporting small rural communities and being involved in research to support normal physiological birth.
Thank you for sharing that. And you mentioned you're way far up north there. What would you think that makes your work different from, let's say, you work in a rural setting, from like a setting in a more urban area?
Well, it's got its challenges and its rewards. I think one of the main things that we've been involved with here is supporting communities in the repatriation of birth when they don't have local cesarean section capability or even local permanent physicians. So a midwifery model of care in Fort Smith and Cambridge Bay and Hay River, where we collaborate as a team to help women make decisions about the location of birth. And that provides interesting conversations and challenges about risk assessment and management, and really putting women's autonomy and choice at the forefront for decisions as big as that about whether you're going to deliver 5 hours away from an operating room. That puts everything else that we do in perspective. So smaller decisions about whether to accept antibiotics or not, or have an induction or not, or a cesarean section for a breech, all become much more woman-centered, if you want, the focus of the conversations around those clinical conditions. So that's kind of an interesting, unique aspect to practice up here in the north that I enjoy and I find rewarding.
Thank you for sharing that. And you mentioned something very important there. You mentioned women's autonomy and choice. And to hear that from you as an obstetrician, I am excited to hear that. I'm a midwife myself, and you are not only, what is very important to you is preserving physiological birth and avoiding unnecessary obstetrical interventions, but you're also an expert in breech birth. Isn't that right, Dr. Kotaska?
Well, I don't know about expert, but yeah, I've involved myself, and I had the good fortune to work with Michael Krause in Nuremberg for some time as a trainee, and they have probably one of the units with the most experience in vaginal breech birth in the world. And yeah, that has been an area of interest, and largely because I think we were led astray by the term breech trial in terms of understanding the application of randomized controlled trial research methodology to a very complex question. And it really also left women's choice out of the equation. So part of my journey has been trying to re-inject a more objective view of the evidence and the level of risk, and reincorporate women's choice into decisions around birth method with breech birth.
And I can hear almost, if I could hear our listeners now, I could hear them say, oh my goodness, I wish Dr. Kotaska would be in my area here. We need more obstetricians like him, you know, defenders of physiological birth and breech birth. Why do you think it is so, I don't know what the right word would be, difficult for obstetricians to involve women's choices more or preserve physiological birth? What is your opinion on that?
Well, that's a big question. I give a whole hour talk on informed consent and refusal and why obstetricians have difficulty with that. But part of it is vestigial leftover of the well-meaning paternalism, but often misguided. You know, physicians and obstetricians take it seriously, their responsibility to their patients, and to do the maximum benefit that they can in helping patients make decisions, and they also tend to feel personally responsible for outcomes. So when they think a particular plan of action is safer, and a woman wants to choose a different plan of action, that can lead to a conflict, and they have difficulty relinquishing the locus of control, partly because you know, they're used to having the locus of control, but partly also because they feel responsible for the outcome, and if there's an increase in risk, they don't want to take that for their patients, and they don't want to own it themselves, ethically or legally. So that's yeah, that's a large topic, but perhaps another time I can delve deeper into it.
Thank you for that. And I know I put you a little bit on the spot there, but I could not resist, and thank you for your answer on that. Now diving into your topic here that you will be presenting on, the two-step delivery and the prevention of shoulder dystocia. Tell us a little bit about it without, of course, giving too much away, because we want our listeners to, or our participants to come to the presentation. But tell us a little bit, what is the two-step delivery, and tell us a little bit about the presentation on prevention of shoulder dystocia.
Yeah, I think in practice is something that was puzzling to me always, was to look at the literature and see different case series with widely discrepant incidences of shoulder dystocia. And like many things in obstetrics, it's a very dynamic situation and also a dynamic diagnosis. Very unclear exactly when a shoulder dystocia is occurring. And some rates were 0.2% and some rates were 4%, and that doesn't match with the physiological phenomenon. So that sparked an interest and a willingness to dig a little deeper and come up with a very interesting dichotomy, that there's sort of two paradigms behind birth of the shoulder after birth of the baby's head. And that's what this talk is about, that discrepancy of those two paradigms. And again, of course, it relates back to physiological birth and why we've often been fearful about what Mother Nature has worked out for us. And so I'm hoping that this will give fellow supporters and advocates of physiological birth some ammunition to downregulate the fear factor that surrounds birth in general, and in particular the approach we have in medical obstetrics to shoulder dystocia.
Yeah, you brought up a very interesting point there, a very valid point, that when is it really a shoulder dystocia? I remember when I was in training, you know, at some birth, the midwife would say, oh, this is not a shoulder dystocia, this is just stuck shoulders. And for somebody training, it was always very difficult to see, okay, what is really the dystocia and what is just a little bit of stuck shoulders here. So I'm very excited about the talk to learn more, you know, and exactly how to handle it. When we as midwives or healthcare providers think about shoulder dystocias, we always get this tightening in our chest, and we think like, oh my goodness, now this is a big one, let's not have a shoulder dystocia, you know, every birth you go in. What can you tell, and this is like, I put you one more time on the spot here, Dr. Kotaska, what can you tell our listeners? I know you could talk for hours on this, but like one nugget here to take away. what can you tell if you see, or if you have a healthcare provider, midwife, anybody in the team walking into a birth and it turns out, okay, this looks like a shoulder dystocia. What is one thing that you would tell them in that moment, if you could?
Listen to this presentation before you're in that moment. I can't put it into one sentence, unfortunately. But I think that if you listen to this presentation, your heart rate will be 20 or 30 beats slower than if you haven't listened to this presentation.
Well, thank you for that. That is certainly a good way of putting it here to our listeners to come to the presentation. And thank you so much to you, Dr. Andrew Kotaska, for sitting down here and chatting with me today about the upcoming presentation. It was such a pleasure having you here with me today.
Oh, thank you.
And to our listeners now, the two-step delivery and the prevention of shoulder dystocia is part of the Managing Complications During Birth lecture pack here at Gold, and this will be available starting February 4th, 2019. For more information on this presentation and the other presentations in this lecture pack, please visit goldmidwifery.com and also goldlearning.com. Thank you all for listening here today. Bye-bye for now.